Hey guys, it's Dr. Ivy Brannon here of Simplicity Health Associates, naturopathic doctor, and I'm really excited for today. We're doing another live interview. So we've been doing a lot of interviews on the channel. We did first with Dr. Melissa King talking all about mental health and herpes. A few weeks ago, we sat down with neurofeedback trainer Alexis Pace to talk about women and ADHD. And today we have Dr. Riva Preil, and she is a pelvic floor physical therapist, and we're going to be talking about postpartum pelvic floor physical therapy. If this is your first time tuning into us or many of times, don't forget to subscribe to the YouTube channel. And if you like today's interview, please don't forget to like this video. And hopefully, if we have some time and people are interested, we're going to have a live Q&A with Dr. Preil. So a couple of things about Dr. Preil. So she is the founder of Revitalize Pelvic Floor Physical Therapy here in New York City with, is it 2 or 3 locations? 4 locations.
One is in Jersey, so 3 in
Okay.
New York. Yeah.
Okay, 3 in New York, 4 total. She is a leading pelvic floor physical therapist. She treats women with various pelvic floor disorders, including interstitial cystitis, constipation, incontinence, vulvodynia, pelvic organ prolapse, prenatal and postpartum conditions. And we're going to be talking a lot about that today, and chronic pelvic pain. She also works with children treating pediatric bladder and bowel dysfunction. She has a lot of credentials, so she is a board certified specialist in women's health physical therapy. She received biofeedback certification in treating pelvic floor dysfunction from BCB PMD. She is also a certified lymphedema therapist through the Academy of Lymphatics, allowing her to treat individuals who experience upper and lower extremity swelling. She is also trained in cranial sacral therapy and visceral mobilization through the Burrell Institute. And Riva is an author. She is a writer. She wrote this inside story, The Women's Guide to Lifelong Pelvic Floor Health or Pelvic Health, which is available on her website, revitalizephysicaltherapy.com. And of course, we're going to have all the links to all of Riva's contact and her social media presence all in the description of this video. And finally, she's just extremely passionate about her work and looks forward to helping many along their healing journey. So I'm so excited to sit down with Dr. Preil today. And before we get into the nitty-gritty of postpartum pelvic floor dysfunction and what we can do with it with pelvic floor physical therapy, I wanted to kind of have our viewers learn a little bit more about you and what led you to become a pelvic floor physical therapist. I mean, many people probably on this interview might have not even known that was even something that even existed. So what drew you to this line of work?
Sure. Well, before I answer, thank you so much for having me, Dr. Ivy. I am, as you said, super passionate about the work that I do, and I warmly embrace any opportunity to help educate the larger, broader community about pelvic floor dysfunction and pelvic health, in part because it's something that so many people don't know about, and everyone has one. And it's important for people to understand how their pelvic floor serves them, what it is supposed to do, so that way when it is not serving in those roles or there's dysfunction or issues with the pelvic floor, they can get the help that they deserve. So how did I first become a pelvic floor therapist? Great question. I was in my 3rd and final year of PT school at Hunter, and I really didn't know at all what pelvic floor therapy was. In my mind, it was just about incontinence, and I didn't really care to be helping people with incontinence and peeing issues. So I kind of just didn't even really consider it. until a close friend of mine, actually, on the topic of today's conversation, had unfortunately a traumatic labor and delivery, and
Mm,
she probably even medically induced, in my humble opinion,
mm,
on the positioning that they put her in during labor, and she had what's called a diastasis pubic symphysis, or a separation of the two halves of the pelvis. And
wow.
she needed to go to pelvic floor therapy. And she says to me one day, Riva, it's amazing that you're becoming a PT because you'll be able to help women like me. And I was like, I'm so sorry, my dear. No, I would not. I don't know the first thing to do for your postpartum issues. I know hips, knees, shoulders, backs, nothing about prenatal postpartum. And she says to me, Riva, you should really meet my pelvic floor therapist. She's changed my life.
Mm,
And I said to myself, that's pretty powerful. I want to change people's lives. So her therapist, a wonderful, wonderful clinician out in Great Neck named Dr. Marilyn Friedman, who's since become a mentor of mine, she very kindly took time out of her busy schedule to make time for me, a little student, to open my eyes to the world of pelvic floor therapy. And she helped me realize it's a lot more than just incontinence. There's the whole pelvic pain piece. There's the prenatal postpartum, constipation, bowel dysfunction. And I definitely was intrigued. She told me, if you want to learn more, check out the Herman and Wallace website. They're the leading institute that teaches continuing ed classes in pelvic floor therapy. And that's actually how one specializes in pelvic floor, is by taking classes and then hands-on experience with patients. We don't really delve into it in grad school. And the only way I could describe it is, as divine providence would have it, Herman and Wallace was teaching pelvic floor 101 class several weeks later at Hunter College, where I was a student, and I got to take the course for free. I asked the director of my program, hey, can I like help set up snacks and coffee and like take this class? He was like, yeah, absolutely. And it was Herman and Wallace, the two women who run the institute, who are just like these powerhouse, dynamic, incredible women who were teaching the course. And I called my mother after the first day. I said, Mom, I found my calling. This is just, it speaks to me. It's what I'm meant to do with my life. The concept of helping people with such personal, intimate aspects, things that oftentimes people are, but actual treatment and help fix problems that have at times been going on for months, if not years, is just really, really rewarding. So that is why I love what I do so much. And that is why, again, I thank you for inviting me here to share the wealth.
yes, yes, definitely. And I kind of want to do like, I was like thinking about like, there's so many questions obviously I have for you. And your ears are kind of leading me towards my first question, or something that I think that maybe our viewers might be more interested in. So I noticed that you are wearing pelvises, right, on your, I'm assuming those are pelvises?
Those are correct.
So maybe take
One
us
of
a
my
journey.
close friends, one of my close friends has a 3D printer, and these are the gifts that I get from my friends.
Okay,
Pelvis
that's
earrings.
super cool. And I know that you're also like very into like visual aids in general. So maybe walk us through a little bit of like pelvic floor anatomy. Like maybe pretend like that we're like new clients. Ooh.
Never too early in the morning to shove a vagina in someone's face.
Right.
Yes, so this is the pelvic floor. First, let's do most superficial to then deeper. We have here, this is the external perineum, the vulva. There are three openings in the female pelvic floor. There is the urethra, which connects to the bladder, the vagina, which connects to the uterus, and the anus, which connects to the rectum. If you peel away one layer, we have here the most superficial layer of pelvic floor muscles. Here in the middle, we have the vagina. On top of it is where the urethra would be. These are the more superficial muscles. Then peel away. We're going actually peeling away two layers. This is layer 3, the third and deepest layer of pelvic floor muscles, which are referred to as the levator ani muscles. And all of these muscles, as you see, because the muscles surround the openings in the pelvic floor, when you squeeze or contract those muscles, it closes those openings. So
Mm.
that's how you maintain continence. On your way to the bathroom, after you feel an urge and you get up and go to the bathroom, it's those muscles that are squeezing and closing up the urethra or the anus that allows you to maintain continence until you get to the bathroom, sit on the toilet, relax and release those muscles, which then opens the openings once again, which allows you to then urinate or defecate. So function number 1 of the pelvic floor muscles is continence. Function number 2 is organ support. Because these muscles rest, think of them as a bowl or a hammock that sit at the bottom of the core, okay? So your organs, for the female pelvic floor, the bladder, the uterus, the rectum, they are suspended up and aligned against gravity, which is working all day, every day against them, via ligaments. Ligaments are structures that connect the organs to the lumbar spine, to the low back, to keep them from falling out of your body. Now, at times, especially with pregnancy, labor, delivery, especially vaginal deliveries, where there's a lot of downward pressure on the organs, those organs can descend or prolapse. In the event that the organs are descending, strengthening the pelvic floor, the hammock below the organs, serves as a great backup plan or plan B to help keep those organs up and aligned against gravity, which is working against them. So again, review. Function number 1 is continence. Function number 2 is organ support, especially in the event that the ligaments are lax or weaker. And function number 3, what?
So, sorry, as you're talking, so would you say then, with organ support, that it would actually be really important as like a prenatal plan to strengthen those areas of the body prior to birth in anticipation that there could be a potential prolapse? Just
great question, Dr. Ivy. Perhaps, but not necessarily. It depends on the whole picture of the pelvic floor, because if the pelvic floor is tight or overactive, then doing strengthening exercises will only further strengthen a system that is already too on. And in that case, you wouldn't want to strengthen or turn them more on, because that would then create, and it's so interesting because I love the gifts that I get from friends. And actually, this one was from a patient. It's a tote bag that says Kegels aren't for everyone. Kegels are pelvic floor strengthening exercises. And they're not for everyone, because if your muscles are tight, you need to stretch, lengthen, and release them, not turn them more on and tighten them. So I would say this: if someone has never had any history of pain, either with inserting tampons or during sex or at a gynecological exam, then it's safe to assume that there is no issue of tightness or overactivity in the pelvic floor. As a healthcare provider, I'm a big fan of always just like having someone do an exam and prescribing exercises that are definitely appropriate for you before just blatantly making a like, oh, everyone should do Kegels. I'm not into that as much, but if you haven't had any history of pain, then it is likely the case that Kegels are appropriate for you. So that would be a good prenatal strengthening protocol, under the guidance of a pelvic floor PT, to help prepare, or you could think of it as prehab for delivery and the postpartum phase. Yeah. So great question. So
that's number 2.
That's number 2. Function number 3, and this is a really important one, is sexual functioning. These are the muscles that need to be relaxed and released enough in order to tolerate anything being inserted vaginally. These are the muscles that need to be relaxed and released enough in order to contract, relax very quickly, and then massive, big relax, release, aka an orgasm. So sometimes if people have tightness in the pelvic floor, they'll report that they have trouble achieving an orgasm or anorgasmia. And that's because if the muscles are like this all the time, they can't serve you in the way that they were designed to serve you. So continence, organ support, sexual functioning are the big 3 important functions of the pelvic floor muscles.
It's amazing. Thank you. And I know that you kind of like interweaved, some of these things, but I just kind of wanted to like piece out again, because like we're talking about postpartum pelvic floor health. And so what are some of the common postpartum issues that pelvic floor physical therapy can help with?
Yeah, great question. So when I'm evaluating a person postpartum, the top things that I look for, number 1 is the abdominal wall. Number 2 is the pelvic floor. Number 3 is the organs. And number 4 is if there's any scarring. So let's break it down and do one by one. Abdominal wall, okay? We have our 6-pack rectus abdominis muscle, which during the course, as the fetus is growing, as the abdomen is expanding, think of the two halves of the rectus abdominis muscle as they're getting open and stretching apart. They're kept together by a connective tissue sheath called the linea alba. And with the expanding fetus and abdomen, that can then get overstretched, which causes the two halves to separate. When that happens, when the separation is more than 2 finger separation, it's considered clinically significant. It's called diastasis recti, and or separation of the two halves of the rectus abdominis. And that is something that we then want to close the gap and strengthen the rectus abdominis in a more closed position. So I do a taping technique to help close it. Then I teach patients how to wrap a sheet around their abdomen to provide an extra layer of closure. And then they do, it's a very simple exercise. They just do head lifts, 50 of them a day, without even clearing the scapula off the floor. It's literally just lifting the head, and that activates the rectus abdominis muscle and helps strengthen it in a more closed position. Okay, so that's part one.
And that's
Number two,
interesting because I think maybe some people didn't realize that a pelvic floor physical therapist doesn't just work in the pelvic floor directly, but they might be working on accessory muscles in other body systems.
totally. And I like to say to my patients, as a holistic provider, I'm not going to just treat your pelvic floor in isolation. If there's something going on in your pelvic floor, there may be something else going on in your hips. There may be something going on in the abs. There may be something in the buttocks, in the glutes. So we like to treat the whole person and not just their pelvic floor.
Amazing.
Thank you. So yeah, so that's the abdomen. Number 2 is the pelvic floor muscles, because especially if it was a vaginal delivery, those muscles can be overstretched, lengthened, weakened, which can manifest. The primary symptoms that women will report is that feeling prolapse, which they report as either feeling like something is descending or something is coming out of their body, or almost the feeling of like a tampon being partially inserted, or a feeling of pelvic fullness or heaviness. So if that is the case and a person has prolapse, then strengthening would be an appropriate program to help reduce the prolapse. And women also often report, this one also comes up during pregnancy at times, is incontinence. I sneeze and I pee a little bit, or I was running for the bus and I leaked a little. The reason why people tend to have it's called stress urinary incontinence, or involuntary loss of urine during inactivity of increased intra-abdominal pressure. So coughing, sneezing, laughing, these are all activities where there's pressure being placed downward on the organs, which then pushes on the bladder and makes one more likely to leak, especially if their muscles aren't strong enough to close around the urethra and help maintain continence. So checking if there's weakness, then again, the 2-for-1 deal, the same exercises that help with the organ positioning and prolapse helps with the incontinence. So when you do Kegels, it's like a 2 for the price of 1, both organ support and continence. So we can check, and number 3 is checking for the organ alignment. If the organs seem to be descended, then we would teach them, assuming there's no overactivity or tightness, we would teach strengthening exercises. And last but not least is scarring. If there's any scar tissue, either from a C-section, or even if there was tearing or an episiotomy, and then there's scarring, anytime that there's scar tissue, it needs to be mobilized. So think of a scar as your body's way of healing that which has been severed. So what your body does is it lays out collagen fibers in a cobweb-like formation to heal that which has been severed. But oftentimes the body does too good of a job, and then there could be restrictions or adhesions, which can then interfere with mobility. It can cause pain. It can sometimes, if people are trying to do twists, they'll feel a pulling. So when there's any scarring, we want to mobilize the tissue, get it flowing freely and smoothly once again, so that there's no pain and you can then move in all the ways that you want to be moving.
There's so much. I'm like debating what to ask next. I think actually I want to ask this now. I'm just kind of curious, like from after giving birth, what is like the best time frame to start a consultation with a pelvic floor physical therapist? Is it when symptoms or issues occur, or right after? Also, like, is there needing to wait a certain period of time before consulting with a pelvic floor physical therapist? Maybe talk a little bit more about that.
Sure. So the best time for starting your postpartum care is when you're pregnant. And this
Yeah,
goes
right.
back to your question that I love, and I've been getting more and more. I love that people are pelvic floor is now a buzz. People are aware of of our existence, and I have women call, hey, I'm pregnant. I don't have any pain, but I want to prep my body for
Mhm.
delivery. Can I come in for a session? It's usually even just like one session, teaching them exercises, stretches, and then we can go over how they would do assessing and making sure there isn't
I was
tightness in
gonna
the
say
pelvic floor.
assessing, yeah, that would be like because it's very individualized. Because what
Correct.
would work with one person might be the worst outcome for somebody else. And
Exactly.
only working with a professional, you would know
Mhm.
that.
Exactly. And the great thing about being able to get assessed when you're pregnant is that once you've delivered, you have to wait 6 weeks for any until you get your 6 week OB clearance. So even if you're not tight and you want to learn how to do Kegels, the best time to learn them is when you're pregnant and you can actually tolerate internal. You're allowed to have something internal. And the best way to learn how to do Kegels is tactile cueing. 50% of women perform Kegels improperly. A lot
Mm.
of people substitute they squeeze their abs, they squeeze their inner thighs, they squeeze their glutes. They're squeezing everything but their pelvic floor because people don't know about their pelvic floor. It's such an obscure part of the body that no one thinks twice about so long as it's doing what it's supposed to be doing. So, in order to learn properly how to use the pelvic floor muscles, the best way is through someone inserting their finger, a pelvic floor therapist, and then teaching you how to contract and relax those muscles. Which, by the way, it's really great to just connect with your pelvic floor before delivery so you can help with
Mm.
relaxing. You want to be relaxing, releasing during delivery. So you want to make sure that you're not tight, that you're able to connect with your pelvic floor muscles and push properly. So that's another reason why it's great to have at least just one session before. Plus, you could then go over how to do Kegels properly. So, postpartum, day 0, you can start Kegels. You can't have someone
Mm.
insert their finger and teach you how to do Kegels, not until 6 weeks, but you can definitely start on your own in the immediate postpartum if Kegels are appropriate for you. In addition, if anyone's had a surgery, C-section, or any tearing that was stitched up, we give it 6 weeks to heal before doing any scar mobilization. And the other thing I'd say about immediate postpartum is, especially for women who are breastfeeding, please breastfeed for as long as you want, but just be aware of the impact it has on your body. It suppresses estrogen.
Mhm.
So it's almost like as if someone is postmenopausal. It's
Yes,
increased
actually, it is. It is very much.
yes.
I have a whole video on that. Yes.
And you don't want to overdo it too fast. I had one patient who she was so physically fit and worked out before her pregnancy, during her pregnancy, and then postpartum, after a couple of weeks, she was like, "Oh, I want to go for a 6 mile run," and she came back with a prolapse because
Mm.
she overdid it. So be kind to yourselves and your bodies. You've just undergone. Your pelvic floor undergoes. You don't want to think about it as a trauma. It's beautiful. It's miraculous. It's wonderful. But it's also a trauma, especially if it's a vaginal delivery. So just take the time that you need, move mindfully, move smartly. There are online forums ready to return to running. Just check in with things like that to make sure that you're not overdoing it too soon, too fast, because God forbid you don't want to create injury to your body as it's healing.
That's really helpful. And you kind of were touching on it a little bit, but I thought it might be interesting if you kind of describe like what actually happens during a pelvic floor physical therapy session. I know probably many people here watching us have maybe done regular PT. I know I have, and we understand a little bit like, I hurt my shoulder and I'm going to do some assessment and exercises, but I guess walk us through what a typical visit looks like, and also if there are differences, and I think you also kind of touched a little bit about that, like some of the differences between what might happen for somebody who's pregnant or postpartum during a pelvic floor physical therapy session or assessment
Sure.
or appointment.
So first things first is the therapist is going to chat with you for a while. It's not just like a 5 second, okay, what's hurting, what's going on. I spend an hour with my patients at their evals, and a nice chunk of that is chatting, getting their history, learning about what if they've had any previous surgeries, if they're on any medication, what their obstetric history looked like, what their job entails, all different things that are extremely relevant to understanding their life, what their body needs, and how to best help them. So after the chit chat subjective portion, with consent, of course, because everything in pelvic floor PT we're super big on. I'll be seeing a patient for the 15th time and ask them for consent every single time to touch them, especially with internal work, because pelvic floor therapy often involves internal work. So when we're dealing with, let's say, prenatal, so if there's any pain, I'm going to assess and see, especially low back pain, checking and seeing what the muscles are like. Oftentimes, because of the changes, the physiological changes that occur during pregnancy, as the fetus is expanding, your center of gravity is moving forward and downward, which causes your back muscles to get shorter. As your abdomen is getting longer and lengthened, your back muscles are getting shorter and tighter. So oftentimes women will have pain in the low back. So assessing those muscles, treating them, doing manual therapies such as soft tissue mobilization, myofascial release, teaching patients how to do homework. I'm a big believer in enabling my patients to make progress on their own in between sessions and give them a ton of homework. So whether that's using a trigger point ball to release tension and tightness in the muscles, or a massage stick, then teaching them appropriate stretches. So there's the external portion. And then with patients who are either past their 6 weeks and have clearance, we would then do, with their consent, an internal vaginal examination to determine the status of the pelvic floor muscles. Are they tight and not yet ready to do Kegels? Or are they weak and overstretched and lengthened? And are their organs descending and they need strengthening exercises? And of course, I double gloved, lots of lube to try to make it as comfortable as tolerable for patients. Because I recognize that most people who go to pelvic floor therapy don't want to be going. It's not like a knee or a shoulder.
Yeah.
It's very sensitive. It's very intimate. So the most important thing is that people feel comfortable 100% of the time, and you should feel comfortable 100% of the time with your provider. I tell my patients, this is you going to a doctor needing to be poked and prodded as I see fit. This is you in the driver's seat steering the wheel at all times. If anything is ever not feeling comfortable, please communicate that to me. So really taking guidance from my patients on what they're ready for. There are people who say, I came here today and I wasn't expecting anything internal. Can we wait till next time?
Mm.
And we do. We respect whatever each individual's body is comfortable and preferring on that given day. So that is what it looks like. If there's scarring, we would do scar assessment and then diving right into treatment, mobilizing that tissue, getting it moving freely and smoothly again. And of course, with postpartum, also assessing the abdominal wall. We do that by 2 fingers, really just pushing in at the umbilicus. And then the same exercise I described earlier, the head lift, which is treatment for diastasis rectus, is also the same thing I have patients do for the assessment. So checking and seeing how much are their muscles closing around so if my fingers are here and then they're only closing up to here, that's like a 3-finger separation. If it's closing till here around my fingers, that's 2 fingers, but that's the threshold of clinical significance. If I'm feeling it, I then remove a finger. And if I'm then feeling it's closing even more, that's not clinically significant. We don't have to really tape or do much for that. But checking the abdominal, also checking above the umbilicus, checking below, because diastasis isn't necessarily limited to just the umbilicus. It could be anywhere along that abdominal wall. So we assess in different parts and see which areas need taping.
Now, I was just kind of curious also about, so, someone decides to come to see you. Is that typically because the woman has spoken to their gynecologist, their midwife, their OB, and they're suggesting it, or a doula, or they're just kind of like coming up with this on their own? Like, I guess I'm just curious about that kind of like that referral process, how that typically works, or maybe there isn't a typical.
Great question. All of the above. We see all of the above. And my message to you, dear viewers, is please don't wait for a doctor to refer you to pelvic floor therapy. I think every state in the United States has some degree of, it's called direct access, which means you don't even need a prescription
Exactly.
from your doctor you can call a physical therapist and make an appointment on your own. In France, all women are sent to pelvic floor physical therapy postpartum. It's
Wow.
just like par for the course. You had a baby, whether it was vaginal delivery or a C-section, you're going to pelvic floor PT. We're not there just yet. My life mission, one of my life missions is to change that and fix that here,
Mhm.
because there are too many women who are just suffering in silence. The number of people who are told, oh, well, that's just your postpartum body now. So sorry. No, there's help that exists.
Not acceptable. Not
Not
acceptable.
acceptable. Dr. Arby, one of my wildest stories is I had a patient who self referred several years after she had had a C section with her second child. And sex hurt her after this delivery. There must have been scar tissue. C-section scars are very close to pelvic
Now,
floor.
was it a planned? Sorry, was it planned C-section or was it an emergency section?
I don't think so. I think it was emergency C.
Hmm.
Either one, though, planned
Right.
or emergency, there's a scar there, which can then create issues in the pelvic floor. And she said to me, she spoke to her doctor about it, and her doctor was like, well, I'm sorry, that's just your postpartum body now. And several years later, she happened to be training to become a doula. And in the course of her doula training, she learned about pelvic floor PT. And she was like, hey, wait a minute, maybe this can help with my pain. And she self referred. And voila, thankfully, we were able to help her achieve her goals. Now, I don't want to come, please, please, please. My message is not to be negative about doctors. There are many, many
Right.
wonderful,
Of
amazing
course.
doctors out there who are doing such important work and referring people appropriately. Amazing. We love them. And also that because pelvic floor therapy is kind of new and gaining traction and something that for a while people didn't really know or talk about, there are other clinicians out there who don't necessarily know about it and aren't referring appropriately. Don't wait to be referred. If you trust your gut, if something, especially if your gut is telling you like, oh, I feel like I'm falling out of the body here. Like if something is feeling off in your body, you know your body better than any doctor ever will. And if you think that, based on, especially after all this information that we're discussing today, if you feel like, hey, I kind of feel like maybe I can relate to the symptoms she's describing, chances are pelvic floor PT will
Hmm.
help you.
Yeah, I think that's really, really helpful for viewers. And this probably is a question that I probably could have started off with. But what are some of the main signs and symptoms of pelvic floor problems? And then maybe even some signs and symptoms that people are surprised are connected to the pelvic floor.
Yeah, great question. The big ones that I like to say are, let's divide it into, remember, there's the underactivity, straight up weakness, where Kegels are appropriate. And then there's overactivity, which is the tightness. So weakness often manifests as urinary incontinence, the feeling of fullness or the organs are coming out, prolapse symptoms. That's what weakness is often described as. When there's tightness, it can manifest as difficulty with starting urine flow, feeling like you have to pee all the time. Because if you are, remember the fist squeezing around the hole,
Mm-hmm.
okay? So if your pelvic floor muscles are really tight and not opening and relaxing and releasing fully around that urethra when you're trying to urinate, you're not going to be able to empty the bladder completely. And then you're going to have to feel like you have to pee 10 minutes after you just went. So urinary frequency or feeling you have to pee all the time could be indicative that the muscles are not relaxing and releasing when you're urinating, hence the need to pee all the time. Constipation is a big one. If you're having difficulty with passing bowel movements, if you feel like you have to strain to poop
Mm.
or to pee, that could be indicative of tightness of the pelvic floor muscles. A big, big one is dyspareunia or pain during vaginal penetration. So that could be indicative of pelvic floor tightness. There's also like incomplete emptying. Sometimes people report that they are able to go to the bathroom, but they don't feel like they're able to completely empty bowel or bladder. Those are all signs that there is likely pelvic floor issues that stand to benefit from treatment.
And I guess like with things specifically like related to bladder and digestion, like you were talking about constipation, incomplete bowel movement, I would assume, or maybe it should even be part of the workup. Because often, like, I know that again, this is sort of like a little bit of a segue of a different topic, but I mean, I work with a lot of different digestion issues. And we'll often do a stool analysis, look at their diet, look and see if there are any like food allergies, and so maybe even when everything is like we don't know, everything is like normal, perhaps like definitely that would be a great time to investigate pelvic floor physical therapy. Or maybe on the opposite end, maybe that should be the first point of contact is looking at pelvic floor dysfunction and seeing if that's really the underlying cause. And of course, there also is the possibility that both are working together. But if you're treating the microbiome, you're eliminating certain foods that aren't working for the patient, but they're still not getting better. Probably pelvic floor should have been brought on this whole time.
Yeah. Dr. Avi, I'll tell you this. The number of people that I have worked with who have gone to doctors and have had workups, imaging, checking urodynamic testing, the whole gambit, and they had pelvic floor muscle issues the whole time is very significant. Now, of course, there are people who have other issues.
Right.
I'm not one of these people who's like pelvic floor therapy is the answer to everything. No, like there are definitely, like if someone has SIBO and they're having bowel issues because of, like, that is beyond my scope of practice. I can't fix the SIBO. I can, anytime there's a gynecological condition, which could be, or a GI issue that could be affecting the pelvic floor muscles, I can help with whatever's going on in the pelvic floor, but I can't fix the underlying issue. So I like to, endometriosis. Let's go there for a moment. That's a
Mm.
gynecological condition when there's endometrial like lining growing outside of the uterus instead of in the uterus. And then what happens is whenever the body perceives something that's a foreign invader or that it doesn't want there, or a space occupying lesion, similar to an infection like a UTI or a yeast infection, the pelvic floor muscles often tense up and tighten up as a guarding mechanism, as an automatic response, as a way of trying to prevent that which is there from entering or from invading their territory. So I can't fix the endometriosis. A person needs surgery for that. But we can help with the subsequent pelvic floor issues that often develop in response to the endometriosis.
Yeah, I think that's really helpful. And kind of want to follow up on, you were talking about that doula who realized that she had had pelvic floor dysfunction. And I don't know how much time had lapsed. Was that like 5 years or a decade? But I'm kind of
Seven,
curious.
7 or 8.
7 years. So I'm wondering, maybe some viewers or somebody might know somebody who might have had like a traumatic birth, let's say in the 80s or 90s, and they've been like silently suffering. Is there also like too little too late? Meaning like, is it too long, like 20 years, 30 years postpartum, finally picking up that phone? Is there anything for these women? Is
I
there a
love the
way out?
question. It's never too late to mobilize a scar. And I'll tell another story to emphasize that point. I had one patient who had had a hysterectomy, which she possibly didn't need. Oftentimes, women are told they need hysterectomies, and they don't. No one should ever have a hysterectomy without having gone to pelvic floor therapy first. But, anyways, that's a whole other soapbox of mine. Anyways, she was experiencing pain. This woman also was a dancer. So, she needed to move. She needed to have full range of motion within her body to do her job. And I believe her surgery was in the 90s. So minimally invasive was not really a thing back then. Now a hysterectomy, you can get away with a pretty small scar. Hers was literally from full length across her abdomen.
Oh my gosh.
And her scar tissue got so bad over time that what finally got her into pelvic floor therapy, it must have been in the 20 teens, so more than 20 years later, was that it ruined her relationship. She literally couldn't have sex with her partner, and it got so bad to the point that their relationship ended. And that's when she, forget the not being able to dance and move, etc. Once it was interfering with her relationship, she said, I need to do something about this. And she came to work with me. I don't think I'd ever worked on a scar that was like more than 20 years old. and she did so well. I remember she came in one day and she was like, Riva, I was able to do this. She named the dance move, but I'm not that good at it. Whatever the dance move was, she was able to do this move she hadn't done in years.
Wow.
As she continued to get better, she says, Riva, I'm ready to start dating again.
Aw.
And I see on social media she's in a loving, wonderful relationship now. And so happy that I had the opportunity to help her, to be the agent of healing to help her get there. But meaning it was never too late to mobilize. That scar was more than 20 years. And you can always, always, always work on a scar to help your body, to feel better in your body and do all the things that you deserve to do and enjoy in life.
I think that's really helpful for our viewers, especially because like sometimes, there's this feeling of, I've had this forever. It's never going to get better. And this is an example that, it's never too late. And if you have pelvic floor dysfunction and you've been silently suffering, it's, whether it's working with Dr. Riva or another pelvic floor physical therapist or talking to your doctor about it, I think it's really important to know that there's still hope. It's not like, oh, you should have done this like 10 years ago. Why are you picking up the phone now?
Yes.
Beautiful.
Oh yes. There are so many people who feel like, why didn't I do this sooner? Because how are you supposed to know to do this sooner? Like if your own doctor isn't telling you because they don't know, then why are you expected to know? And that's why, again, so grateful for opportunities like this to help spread the word as far and wide as possible so that people don't have to suffer in silence. And the other thing that I'm so big on, and what we were just discussing reminded me of it, is the number of patients that I work with who express feelings of my body is broken, or I am broken, or I am failing as a woman, or there's something inherently wrong with me. Like, no, 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 no. It's understandable why people have such strong emotions about this part of their body. It's such an emotionally loaded part of the body, which is responsible for functions that are so vital and important. And there's a lot of psych behind all that, a lot of feelings behind all that. But this is fixable. And if there was something dysfunctional about your shoulder, you'd
Right.
go to PT and it would get better. And there isn't the same emotional, like, I am failing, I am broken, I am inherently, there's something bad, I'm failing as a partner. Like, the same applies to your pelvic floor. There's nothing inherently wrong with you. You're not broken. These are issues that are very, very, very common and also extremely fixable. And there are people like me around the world, not enough. So hopefully there'll be, as the years go on and more women discover this specialty, and men too. There are men becoming pelvic floor therapists. Men have pelvic floors too, and oftentimes need pelvic floor therapy. That's again a whole other
Right.
conversation. But as more and more people are specializing in this, more people are talking about it, more people are getting the help that they need and deserve. But it's not a broken thing. You are fixable, and there's nothing inherently wrong with you, and your body is beautiful, and we're just bringing it back to that wonderful place where you want to be. Because there's definitely a lot of emotions behind the pelvic floor.
Mm-hmm. And as you said before, I mean, I've had a couple of patients, male patients, that have really benefited greatly from pelvic floor physical therapy. So it's not just a women's issue. And to kind of like wrap things up, what would you say are like the five main either tips or takeaways for postpartum pelvic floor physical health, both like what women should be doing prenatally, postnatally? What are like I'd say like the most important maybe five tips or takeaways?
Okay, number one is be kind to yourself and patient. You've just performed a miraculous feat. Be kind and patient with yourself. Number two, the fourth trimester lasts forever. There are so many people who the focus is on mom and baby, mom and baby, mom, like as the fetus is developed, mom and fetus, really. And then the minute fetus becomes baby and is born, focus is all on baby. And
Mm-hmm.
mom is just like, okay, you have a few weeks off from work and like rest, good luck with your first poop, and then go back to work. Be off on your merry way. Like, whoa, slow down, think about what you just went through, and get the help that you need and deserve to make that fourth trimester, which is going to last forever, as smooth and comfortable as possible. Number 3, trust your gut. If something feels off in your body, you know your body better than any medical care provider ever will, and advocate on behalf of yourself, because there is likely help that exists. So don't just accept, well, this is how your body's going to be. 4, it's never normal to sneeze and pee. It's never normal to leak when doing an activity. The poise industry has normalized this. This is not
Mm.
normal. And rather than contributing to that multi-billion-dollar industry, go for a few sessions of pelvic floor PT and let's put them out of business. And number 5, I would say, this is one that's actually, we didn't touch upon this, but it comes up with my patients, and I think it's important, is that as a mom, women put so much, they have so many feelings about mothering and especially about breastfeeding. That's a big one that comes up, where people feel either like successful or not successful. I'm a good mom. However you're
Mm.
choosing to nourish your child, you are sustaining you have housed and birthed and are sustaining a human life. There should be no judgment on any mom for how she is choosing to do so. And there are people who, for whatever reason, can't breastfeed. And women have a lot of emotions about that. And I just want to validate those emotions and also express that that does not impact whether or not you're being a good mom or not. And don't 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 be hard on yourself. Again, goes back to, I guess, number 1, it's kind of related, but be kind to yourself, and let's not assume that everyone is breastfeeding. If someone's on medication, that psychiatric meds that makes them unable to be breastfeeding, like, let's not just make assumptions about anyone and their bodies, and what they're doing or not doing, or whether that makes them a good mom or a bad mom, because it doesn't. That's garbage, and let's just try to eliminate that from our thought processes.
I think that was really, really helpful, Riva. It's a really great list that hopefully our viewers will take from. And first of all, this has been like an amazing. First of all, I love when your energy, but also I love anytime where I'm learning things. I don't even know how much even if our viewers, I'm assuming that they learned a lot from you, but I mean, I learned a lot for sure. And I'm going to have a different view on the pelvic floor and how important it is, specifically when I'm thinking about, the best ways to serve my patients. So that was really, really amazing, Riva. And so again, this was Dr. Riva Preil, who has 3 offices in New York, 1 in Jersey. I guess, well, Bronx is still considered New York, because I know one of them is in Riverdale. And all of her links are in the description of this video. But what is your kind of like your preferred either social media or your preferred links, and maybe even just the best way to find out about your book?
Oh, awesome. Please follow me on social media, Revitalize Pelvic Health. I have an amazing social media manager. We're like creating all this fun content and following trends, and can't wait for you to follow. You can email me. That's the best way to reach me, is Riva, R-I-V-A, at revitalizephysicaltherapy.com. Again, Riva, R-I-V-A, at revitalizephysicaltherapy.com. If you have any questions, for my book, you can check out the website. It's just revitalizephysicaltherapy.com. And there's a link to the book. If you scroll down on the homepage, there's a link to the book on the homepage. And I can't wait for you to read and keep learning more.
Amazing, amazing. And we'll be having some more interviews coming up on the YouTube channel. So definitely do not forget to subscribe. On Friday, September 26th, I'm going to be interviewing Caprice Cabot, who is the primary educator and doula of Birth Smarter. And we're going to be talking all about how to birth smarter. Also coming up, we have Deb Flashenberg of the Prenatal Yoga Center, and we're also going to be interviewing a at-home midwife in November. So looking forward to all these different interviews. So don't forget to subscribe to the channel. And of course, if you like this video, don't forget to like it. And of course, you can always pop in a question in the chat, and hopefully we'll be able to answer that of the recording if you're watching this after the live. And again, this is Dr. Ivy Brandon, naturopathic doctor in New York City of Simplicity Health Associates. Looking forward to seeing you next time.